The next is Kalpasthana. Kalpasthana is a very interesting section in Samhita where the toxicology is really discussed. The first chapter is Athato annarakshakalpam vyakhyasyaamaha yathovacha bhagavan dhanvantarihi. Dhanvantarihi kashipati kapo dharmapradamvaraha sushra prabhuti nishishan shashasa ahata shasanaha ripavo vikramakrantaha yechasve krityadam gataha शिश्रक्षभः क्रोधविषं विवरं प्राप्य तादृशं विषयैः निहन्युः निपुणं नृपतिं दुष्टचेतसः स्त्रियो वा विविधान् योगान् कदाचित् सुभगेच्छया विषकन्योपयोगात् वा क्षणात् जक्ष्यात् असुन्नरः तस्माद् वैद्येन संविशात् रक्षो नराधिपः. Now the annarakshakalpa chapter is mainly targeted about protection of the VVIPs, the kings and others, who have a high risk of getting poisoned as such. So that's the main theme. Of course, it also deals with the other issues which are related to common man even. And the chapter starts with the usual, like the students urging the teacher to teach about the topic. And the reasons why the kings have to be protected are because the kings have more enemies and there are many people who want to hurt the king. And there could be the people of other sex. In Sushra time, like the social condition was slightly different. So women may have also poisoned the king as such with an idea of having a control over the person. Or there could be even Vishakanya, one of the unique concept of a poisoning where a female will be fed with the continuous poisons and a person who comes in contact with her may die. That's Vishakanya also is one of the techniques of hurting the enemies in those days. And the king had to have a physician who would protect the king from all these. So a physician for the king, a royal physician had to be there, and one of the major responsibility of the royal physician is to protect the king from any of these poisonings, either intentional or accidental. Yasmat cheto aniyatvam ashwata prasidambranam namishwasyat tatho raja kadajitapi kasya. As the king's situation is very delicate and it's in a continuous dynamic condition, he should not believe or have confidence, full confidence, total confidence on any of the person. And hence the king has to have a sufficient staff, reliable staff, who can just manage the daily needs of the king. And among the daily needs of the king, food is one of the major issues. So whole of this chapter is mainly aimed at protection of the food and the possible different complications which can occur due to the poisoning or contamination of the food. Now, to ensure that the proper food is protected, the kitchen of the king should have a reliable person who manages the king. There should be a physician who would supervise the kitchen also. So physician had a responsibility of supervising the food preparation. Under the physician there would be a kitchen head. Now the appointment of the physician would be based upon his characters. The characters of a optimum or right sort of the physician would be Kulinam, Dharmikam, Snigdham, Subhrutam, Santatotthidam, Aludham, Ashatham, Bhaktam, Kritanyam, Priyadarshanam, Krodha Parushya Matsaryam, Ayasa Alasya Vivarjitam, Jitendriyam, Shamavantam, Shuchim, Shiladayanidam, Medhavinam, Asamshrantam, Anuraktam, Hideshanam, Patum, Pragalbham, Nipunam, Daksham, Alasyavarjidam, Purvoktescha Gunayuktam, Nityam Sanhitagadam, Mahanase Prayunjita Vidyam Tadvidya Pujitam. A physician who has a very well knowledge and he is very interested in the topic, that production activity, and he is dedicated to the king and should have all that the optimum characters which can make him reliable, and he should be well versed in the agada, that technique of treating the poisons and dealing with the poison conditions. Such a vaidya, such a physician has to be appointed. Tatra adhyaksham niyunjita prayo vaidya gunanidam. there should be a kitchen head who would also have the Vaidya Guna, the properties of the Vaidya. And those other staff in the kitchen would be Shuchaya, Dakshinaha, Dakshaha, Vinitaha, Priyadarshanaha, Samibhaktaha, Sumanaso, Nichakeshanakha, Sthiraha, Snataha, Dridham Sanyaminah, Krutoshnushaha, Susanyataha, Tasya cha Ajna Vidheyaha Syuhu, Vividhaha Parikarminaha. The staff in the kitchen also should have a proper optimum psychological entity. They should be clean, they should be capable of doing their activity, they should look good, and very important, they should have a primed hairs, nails. The nails and hairs should be promptly maintained healthily, and they should cover the head. Now these days the chefs would have that covering of the head. Similarly, Krita Ushnishaha, that covering of the hairs to prevent the possible contamination. And they should keep clean. Such a person should be appointed. Then the type of the persons who would be appointed are Aharasthitaschyapi bhavanti pranino yataha tasmat mahanase vidyah pramadarahito bhavet mahanasika vodharaha saupa vodanika paupikaha bhavehu vaidyavashagaha ye chapyanye atra ketana. Now the kitchen staff would be under the control of the physician, and the physician should continuously monitor their activities. And the staff of that kitchen at that time, very interesting would be, they were of Mahanasika, Vodhara, Saupaha or Audanikaha, Paupikaha. The meaning of these are Mahanasika, Mahanasikaha. The persons who are appointed in the kitchen are Mahanasikaha. And the Rasavati Patayaha, the other name for them is Rasavati Patayaha ityarthaha. Vodharaha, the Vodhara are those who can have that skill in maintaining this urn, maintaining that fire and the stove there. So skilled persons who can maintain their urn and then control the fire there, they are the Vodhara. And Kaharadeha, the other name for them is Kahara. Saupaha, Saupa is those who prepare the Supa Vyanjanadikarkaha, those who prepare the dishes which are supposed to be there. Then Audarikaha, Upakarya Bhuktasya Sadakaha, those who can prepare the rice and other main food assets. Popikaha, those who can fry and prepare the fried food. Upadibhukshamana, Upadibhukshaha are the fried foods as such. These are the different types of the staff which are present to be in the kitchen, and they should be Ingitajah, Manushyanam Vakyesta Mukhavikritihi, Vidya Vishasya Dataram Ebihi Lingeshcha Buddhiman, Nadati Uttaram Prishto Vivakshan Mohametija, Apartham Bahusankirnam Bhashite Chapi Mudhavata, Spotayati Anguli Bhumihi Bhumim Akasma Nilikhet Haseta, Vepatur Jayate Trastya Trastascha Anyonyam Ikshare. Kshamo Vivarnamatrascha Naki Kinchichanatyapi Alabheta Asakrat Dinaha Karena cha Shiroruhan Niryayu Asura Padaihi Asura Padvarehi Vikshadeja Punapunaha Vartate Viparitam Chavisada Vichetanaha. Now among these staff, if at all there is some doubtful person, you have to, the physician has to identify by his behaviors and his characters. You can make out by looking at the way he speaks, the way a person who can contaminate the food or who can harm the king would have some behavioral changes. So because of his anxiety, because of his guilty consciousness, you can assess by looking at his behaviors. He will be, because of his anxiety, he would be looking somewhat secluded. He will not answer the questions properly. If at all there is any specific inquiry, he may faint, like he may look like, act like a painting, or either he may speak too much, which is unnecessary, or he may speak like a ignorant person and maybe irrelevant speak as such, or he may have some behavioral changes, like he may fold his hands, or maybe is scratching the earth as such, or may tremors, or he may look here and there, or he may look pale, and he may be just cutting something with his nails, because of all that, the signs of anxiety or guilty feeling. And he may just scratch his head or hairs also, and he may look upwards and downwards or towards the door repeatedly. With that kind of a behavior, a physician has to identify a suspicious person. केचित् भयात् पार्थिवस्य त्वरिता वा तदाज्ञया असतामपि सन्तोऽपि चेष्टां कुर्वन्ति मानवः तस्मात् परीक्षणं कार्यं भृत्यानाम् आदृतेः निपेः. Some of the persons may have this kind of a behavioral changes even though they may not be guilty because of the fear of the king, and hence the physician has to be very careful and should test the person and should have all that the behavioral patterns recorded or maybe observed to confirm whether a person is guilty or not. अन्ने पाने दन्तकाष्ठे तथा अभ्यङ्गे अवलेखने उत्सादने कषाये च परिषेके अनुलेपने स्रक्षु वस्त्रेषु शय्यासु कवच आभरणेषु च पादुका पादपीठेषु पृष्ठेषु गजबाजिनां विषजुष्टेषु अन्येषु नस्य धूमाञ्जनादिषु लक्षणानि प्रवक्ष्यामि चिकित्सामप्यनन्तरम्. A possible harming or possible poisoning could occur in any medium. It could be annapana food, or it could be dantakashta in the brush for the teeth, or abhyanga during the application of the oil over the body, or maybe during bath, or during exercise, or during pouring of the water, or during some cosmetic application, or it could be in the decorative items or ornaments which are placed over, or it could be over the cloth, it could be in the bed, or it could be in the footwear, or it could be on the seat, or it could be over the these animals on which the king would travel. So, or it could be nasya, dhuma, etc. The poison contamination could occur through any of the medium, and hence the physician has to be careful to identify, and the physician should know how to treat. And this chapter will deal with these issues as such. Though the main is about the food, the main theme is about the food, and all the other possible poisoning also are discussed in the chapter. Now, one of the best means to prevent a food harming the physician would be, you have to give a bali. Bali is offering the food before you eat to some lower animals. Now, this is a very important issue. It's a very scientific method of having the protection, where you give share the food with some animals and look at the behavior of the animals. Then you consider whether the food is safe or not. And this method is followed even now, but somehow now it has become a ritual, and the people consider it as a superstition. So that scientific spirit of that would be lost when it becomes a ritual. And the bali is now considered something like a superstition by many people, but the real meaning is same, but the real intention also has to be preserved. It should not be just converted into a ritual. Anyway, whatever is mentioned by Sushruta is Nripabhakta Balimnyastam Savisham Bhakshandiye Tatriva Ye Vinashanti Bhakshika Vayasadaya Huda Guttena Chanena Bhusham Charsitayate Mayura Khanta Pradimo Jayate Chapidusaha भिन्नार्थिः तीक्ष्णधूमश्च नचिरातः च उपशाम्यति चकोरस्य अक्षिवैराग्यं जायते क्षिप्रमेव तो दृष्ट्वा अन्नं विषसंसृष्टं म्रियन्ते जीवजीवकाः कोकिलस्वरवैकृत्यं क्रौञ्चत् मदमृच्छति हृष्येत् मयूरः उद्विग्नः क्रोशतः शुकसारिके हंसं क्ष्वेडति चात्यर्थं भृङ्गराजस्तु कूजति पृषतो विसृज्य अश्रुं विष्ठां मुञ्चति मर्कटः सन्निकृष्टां सतत्कुर्यात् राज्ञः तान् मृगपक्षिणः वेश्मनो अथ विभूषार्थं रक्षार्थं च आत्मनस्तदा. Now, the bali is again of two parts. One is the agni, to give to the agni. So it's also a custom now. It has become a ritual. Every time before you take the food, you have to do the agni karya. That food has to be offered to the agni, and the purpose is to see whether there is any abnormal color of the flame or abnormal activity. A flame test is a test which is done in the biochemical laboratories even now to identify the substances in the given chemical. Say when you go for the chemical analysis, one of the primitive tests is the flame test, by which you can identify some of the metals. Right? Similarly, a possible contamination of the food could be identified by offering it to the fire, and when the fire flame would become bluish, Vanyurakanta Pratimaha, then it becomes, or if the flame becomes split as such, or if there is a lot of heavy irritant smoke, or if the food catches fire easily, such of the food would be considered as a possible contaminated, and that should not be taken in. When the food is next is the food is offered to birds and animals. Usually now in our ritual it becomes a kakabali. It's offered to crows, but in Sushira's period it could be of any birds, and the behavioral changes in the different birds would be seen. If it is given to chakora, the color of the eyes will be reddish. If it is poison, if the food is poison, and Jiva bird may die immediately. Kokila may have Sarvaikritya, the change, character of the voice may change. Krauncha, it may become semi-conscious or irritant. Mayura, the peacock, may become more active, hyperactive, and Shukasarika may just go on crying in a different sound or big sound like. Hamsa may have a disturbed behavior. Bringaraja also may just cry in a large voice or loud voice. So this way the behavior, or Markata, the monkey, may excrete the stools or excrete these tears also. That could be tear secretions. So these signs in the different animals have to be seen, and there was a custom of maintaining some animals in the kitchen to test that. Now that kind of a practice still does exist, but the situation is different. There is a FSSA, Food Security Authority of India, has given a manual on general guidelines of sampling. The food sampling is one of the basic discipline which is mentioned there. And for common man, the discipline is something different. But for VVIPs, very interestingly, it's from a news item from an authentic newspaper which I have just put in. Commoners continue to serve as guinea pigs for VIP food testing. So in Sushruta's period, he had some animals in the kitchen which would be used as the models for testing. But now, for VIPs, commoners are used as the common man, maybe a government staff is used for testing the food, and a layman is also used for the food. So that's a very important issue, and this custom is continuing even now as such. So anyway, we'll leave it as such. उपक्षिप्तस्य जन्मस्य भाष्पेण ऊर्ध्वं प्रसर्पदा हृत्पीडा भ्रान्तनेतृत्वं शिरो दुःखं च जायते तत्र नत्स्याञ्जने कुष्ठं लामज्जं नलदं मधु कुर्यात् शिरीष रजनी चन्दनेश्च प्रलेपनं हृदयचन्दनलेपस्तु तदा सुखम् अवाप्नुयात्. Now the effect of the poisoning of the food can occur as per the mode of consumption, or if the steam or the vapors from the food are consumed, that itself can produce the complications like hritpida, pain in the chest, or the vision abnormalities, headache. In such conditions, nasya, anjana, or maybe the lamajana, the madhu, etc., or shirisha, rajani, chandana, lepana, or chandana lepa could be applied over there. Paniprapam, if the food comes into contact with the hand, it may produce a burning sensation, or maybe even nails may become brittle and broken. In such conditions, you may have to apply the lepa of Shama, Indra, Gopa, Soma, Utpalanicha. Different plants could be applied. Sachet Brahmadat Mohabhat Adannam Upasevate Aschilavat Tato Dihva Bhavati Arasavedini Tudyate Dashyate Chapi Kleshmacha Asya Prasichite Tatra Bashperitam Karma Yachasya Danta Kastikam. Now, if the patient, if the king consumes the food, see, the food, before you consume the food, you have to take the vapors, smell the food. Then by touching, you can feel certain of the possible harm message. Then if there are no signs of the harm, then you consume the food. And if the food is consumed, if it is kept in the mouth, it may produce numbness of the tongue, and the appreciation of the taste could be affected, or burning sensation in the mouth can occur. In such conditions, again, the same protocol as is used for the bashpa, that vapor consumed can be taken in. Then if it is swallowed, if it goes into the amashaya, then you will have all the signs of the food poisoning. We use the term food poisoning, and once it goes into the stomach, it may produce murcham, chardim, atisaram, adhanam, dahavepatu, इन्द्रियाणां च वैकृत्यं क्रियादामाशयं गतं तत्र आशु मदन अलां बिम्बी कोशातकीफलैः छर्दनं दधि उदश्वित्याम् अथवा तण्डुलाम्बना. If the food is consumed into the stomach, it may produce vomiting or diarrhea or distension of the abdomen, very common signs of what we call as a food poisoning. And such conditions, the Vamana is the treatment. You have to follow the Vamana protocol by giving either Mudanaphala Labu or Tandulambu, etc. Now, Daham Murcham Atisaram Tishnam Indriya Vaikritam Atopam Pandasam Karsham Kurya Pakvashayam Gadam Virejanam Sasarpishkam Tatrotum Nilini Phalam Dadna Dushi Visharishya Piyo Va Madhusanyutaha. If the food is not vomited out, or if it is not expelled out by the vomiting, or maybe what we call as a gastric lavage, now we may prefer gastric lavage than really vomiting. And if the food is still digested, if it goes into the intestines and absorbed, the toxic substances are absorbed, it may produce burning sensation, impaired consciousness, diarrhea, thirst, or the abnormalities of the sensory organs, distension of the abdomen, or anemia, or even emaciation could occur. In such conditions, Vilechana has to be done with the Niliniphala or Daji, with the Dushi Vishari yogas, different yogas which are used for the Dushi Visha can be tried. Now, even now, the food produced complications, diseases are quite huge. According to WHO, the burden of foodborne diseases is very huge. Among them, the food poisoning and food allergy. There are two aspects, food poisoning and food allergy from the current point of view. And food allergy is where the patient would have sensitivity, whereas food poisoning now is attributed to bacterial organisms, or maybe the parasitic organisms, or maybe the metals or chemicals, substances, artificial substances, and the total burden is to be calculated as a almost 1 in 10 people fall ill due to this food poisoning every year, and it comes to around 33 millions. And in children, it's about 1/3 of the death in children is due to foodborne diseases. This is how it is presented as such. And the WHO has given a caution, like everyone has a role to play. The estimated suggests like 128,000 people are hospitalized and 3,000 die every year. This is from India. This data is from India. And there are about 31 pathogens are identified now, and they produce almost 9.4 million annual cases, 55,961 hospitalizations, 1,351 deaths due to the food conditions, and unspecified agents. See, 31 are known pathogens now, and there are some unspecified agents. They account for 38.4 million cases and 71,870 hospitalizations. This is about the global data. So, at present, 31 pathogens are identified as the pathogenic organisms which can produce the food poisoning, because in the present day situation, it's the organisms they are given more importance than the other chemical contents or the nature of the food. Among these 31, we have to at least have some primitive ideas. I will not go into very significant detail, but certain of the ideas should be known, though from our treatment, Ayurvedic treatment point of view, we may not give much importance to these organisms and their treatment. The treatment can be same, but the idea of prevention of this is quite important. And among those 31 identified organisms, I will be selecting a few of them which are very important from our context point of view. Among them, staphylococci, one, and it's usually due to improper storage of the food, and particularly a food which has high salt or sugar content, it favors the growth of the staphylococci. The clinical symptoms will be intense vomiting and watery diarrhea, which occurs within 1 to 4 hours of consumption and lasts for 20 to 48 hours. The pathogenesis, there is an enterotoxin which acts on the receptors of the gut, and usually these are self-limiting conditions if you take care of the hydration as such. Specific antibiotic treatment generally not necessary. Then Bacillus cereus is another of the organism. It's usually seen in contaminated fried rice. Fried rice is or meatballs also. These are which may produce in a fried rice, it produces a emetic activity, and which would due to the emetic enterotoxin presented over there, and this diarrheal enterotoxin also is presented in series, which produces the same clinical symptoms. Emetic occurs within 9 hours after consumption, vomiting and cramps. Diarrhea lasts for about 24 hours, and clinical presentation is initially it's the vomiting and then the diarrhea as a clinical symptoms. Then Clostridium perfringens is another of the organism which is produced due to inadequately cooked meat, poultry or legumes. Usually the clinical symptoms will be acute onset of abdominal cramps with diarrhea, which starts with 8 to 24 hours as such. Vomiting is rare, it lasts for less than 1 day. And enteritis necroficans is also accompanied, where there will be high mortality. 40% mortality would occur in necroticans conditions, as the colon would become necrotic as such. It's produced, the pathogenesis, enterotoxin is produced in the gut, and it produces hypersecretion in the small intestine. Botulinum toxicity, another quite common, this is common and quite serious also, which can produce a high mortality rate. Botulinum toxicity, which can be seen in canned food like smoked fish, mushrooms, etc. Characteristically, it presents in the clinical presentation of a descending weakness and paralysis, starts usually 1 to 4 days after the injection, and constipation, followed by constipation. Patient would be having constipation, there will be a neurological toxicity, and there would be paralysis. It even can result in this respiratory paralysis, and mortality can occur as such. Toxin is absorbed from the gut, resulting in release of acetylcholine in the neuromuscular junction. Then listeria is another of the organism which also can produce quite frequently in our clinical conditions. It is due to raw and pasteurized milk, soft cheeses, raw vegetables, shrimp. These are the major sources where the listeria can often occur. It presents in the systemic disease and bacteremia. Intestinal symptoms usually present earlier, then result in severe bacteremia. Meningitis or even heart valves, that rheumatism-like symptoms also can occur. Mortality is high in such conditions. And the pathogenesis, because it's a high mortality and high resistant organism as such is. In enterotoxic E. coli, this is another very common condition which is also called as traveler's diarrhea. In India, among the conditions, enterococcal coli, Shigella, Salmonella, Listeria. These are very common in our area, particularly in coastal area, and it is produced due to contaminated water and food like salad, cheese, etc. Characteristically acute onset of watery diarrhea within 24 to 48 hours of consumption. Concomitant vomiting and abdominal cramps also may be presented, and it's due to enterotoxin induced hypersecretion in small and large intestines as such. Then enterohemorrhagic coli, that enterococcal coli, which also produces hemorrhage, one of this variant, can produce due to improperly cooked food, particularly meat, non-vegetarian and spinach. And it progresses into watery or bloody diarrhea, which lasts for 3 to 8 days and may be complicated with hemolytic uremic syndrome. Because of the hemorrhage from the intestines, it may produce uremia, and outcome can be poor. It's a very risky condition. It's due to cytotoxin release in the intestines as such. Cholera is another, Vibrio cholera. Of course, these days cholera incidence has become reduced, but when it occurs, it becomes a very rapidly spreading epidemic, and the source is contaminated water and food. It produces large amount of non-bloody diarrhea, starts within 8 to 24 hours and lasts for 3 to 5 days. And the cholera is a proclaimed epidemic, which can be very critical, produced due to enterotoxin hypersecretion. Then Vibrio species, other species other than cholera, parahemolyticus or vernificus can produce the same. And the parahemolyticus conditions, it's usually due to raw and improperly cooked seafood, particularly mollusks. It produces explosive watery diarrhea, starts within 8 to 24 days after hours of ingestion. And the identification would be, pathogenesis is due to again enterotoxin. The vermifugus often is produced due to wound infection in salt water or consumption of raw oysters, and it can produce it's produced due to polysaccharide contents there. Vibrio vermifugus, of course, the same. Shigella is another common, very common organism which we see. And Shigella, it is through usually potato, egg salad, lettuce, etc. These are the sources, and starts with diarrhea, cramps, and fever. In our area, coastal area, Shigella-induced condition, food poisoning are very common. And the organisms, they produce a toxin within very high infective doses, and enterotoxin mediated diarrhea is followed by invasion. Salmonella is another of the source which is very common in our area, and it is usually source is beef, poultry, eggs, and dairy products, etc. Characteristically presents with abrupt onset of moderate to large amount of diarrhea with low grade fever, and in some cases bloody diarrhea. Abdominal pain and vomiting also is present, and it can last for 7 to 12 days, last longer duration. It's a bacteria itself or invades, and even you may see the culture positive, but toxins are not presented. Yersinia is another very common, which is transmitted through the pets and in humans from the fecal oral route of the pets, particularly milk or ice. It presents with the typical gastroenteritis and mesenteric lymphadenitis. Mesenteric lymphadenitis seen quite commonly. It's due to the Yersinia conditions. Then eromanus is another of the condition, which is due to untreated well or spring water. Many times it could be in the mineral water bottles also. Diarrhea may be bloody and may become chronic up to 42 days, particularly more common in western countries like United States. Of course, these days in India also it has become common due to the consumption of mineral water, that bottled water, than really the untreated well water. As per the textual source, it is due to the untreated water, but what we see is the mineral water which is packed in the bottles for a long duration, in the plastic bottles, the eromanus can grow easily, and it produces enterotoxin, hemolysine as well as cytotoxin. Then Entamoeba histolytica, among the parasites, the most common parasite in coastal area, in Udupi and surrounding area, is Entamoeba histolytica, which is due to contaminated food and water, and 90% may remain asymptomatic, 10% may have dysentery, where there would be griping pain, and a few may develop liver abscess as such. That's one of the very common diseases. Then Giardia lamblia is another of the common organism, which is also a parasitic organism, which can be due to contaminated food and through fecal-oral route and water sources. Mild diarrhea and nausea, abdominal cramps are seen as such. The location is mainly in the jejunum and the duodenum. Then among the seafood poisonings, now from coastal area where the seafood is very commonly consumed, are common, and the mainly among the paralytic shellfish poisoning is quite seen due to bivalve mollusks during rainy season, early rainy season. It's common, like people tend to take these mollusks quite frequently, and usually occurs within 30 to 60 minutes. Symptoms include a paresthesia, then gradually it results in extremities, paresthesia in the extremities, numbness, tingling sensation in the limb, headache, vertigo, ataxia, or even nerve palsies also can occur. Rarely it may even involve the respiratory muscles and resulting in fatal complications. In rainy season, it's quite frequent in our area. Then neurotoxic shellfish poisoning. This is more common in western countries like Florida, America, etc. But in our area, comparatively lesser. It's much milder than paralytic shellfish poisoning, and it's due to the fish acquired toxins. Then ciguataria is another of the seafood poisoning, which is again more common in the western countries than in our area. Of course, here also we do see them, but rarely. Clinical symptoms are vomiting, diarrhea, and cramps, which start within 1 to 6 hours after consumption, last for days to months. Diarrhea may be accompanied with a variety of neurologic symptoms like paresthesia, reversal of hot and cold sensation, vertigo, headache, and autonomic disturbances. and hypertension and bradycardia also. And chronic symptoms may be fatigue and headache, which may be aggravated by caffeine or alcohol. These are the clinical symptoms there. And another of the sheep poisoning, which is again less common in our area but more common in eastern countries like Japan, tetrodotoxin poisoning, which is due to puffer fish, one variety of the fish. Of course, from our point of view, this is not a very important issue, but because of that listing, the general list of the conditions I am just referring to, it's a neurotoxic condition which can produce a paresthesia, emesis, ataxia, etc. Then the metal poisoning. The next is about the metal poisoning. Among the metal poisoning, mercury is one which is often claimed to be particularly consumption of inorganic mercuric salts, or many of the seafood also may be a source for the mercury. Of course, people even claim Ayurvedic medicines, but they do not. Ayurvedic medicines do not do that. The symptoms will be it causes metallic taste and salivation, thirst, discoloration and edema of the oral mucosal membrane, abdominal pain, vomiting, bloody diarrhea and acute renal failure. Lead poisoning, which is also common, particularly people who work with the batteries and so on. It's due to repeated exposure, and in symptoms include colic, abdominal pain, constipation, headache and irritability, and diagnosis is based mainly by the blood test. Arsenic is another common condition, heavy metal substances, which is often consumed in the form of pesticide and industrial chemicals, and most of the food substances which are having that pesticides contents may have arsenic. These are now common become, and the clinical symptoms would be abdominal pain, watery diarrhea, vomiting, skeletal muscle cramps, etc. So these are identified sources as such. There are many other unidentified sources. So it's a very brief discussion about the identified sources of the food poisoning as it is now. Now in Sushruta's period again, the same typical study was there, but majority of these tests are based upon how you look at the food. The appearance of the food itself was considered to be one of the criteria by which these possible contamination or maybe the poisoning could be identified. And the method test would be द्रवद्रव्येषु सर्वेषु क्षीरमद्य उदकादिषु भवन्ति विविधाः राज्यः फेन बुद्बुदजन्मच छायाश्चात्र न दृश्यन्ते दृश्यन्ते यदि वा पुनः भवन्ति यमलाः छिद्राः तन्म्यः सा विकृताः तथा. In liquid food substances, either there could be extra foam or there could be some linings of different colors, that color linings could be seen, or when you look at the shadow of your body through that fluid water, or maybe that liquid which is to be consumed, either the image may not be seen, shadow may not be seen, or the shadow may have a deformed presentation, like either there could be duplicate shadow or there could be a disruption in the continuity of the shadow, or the shape could be altered. Then shaka supanna mamsani klinani virasani cha sadya parishirani ma viganthani bhavanti cha गंधवर्ण रसैर्षीणाः सर्वे भक्षाः फलानि च पक्वानि आशु विशीर्यन्ते पाकम् आमानि यान्ति च. Now the cooked food which is cooked after that, when you look at it, either it may become too moist or the taste may be altered, or it may look like stale food, though it's not stale. The smell and the other presentation will be affected, the color, appearance and the taste will be affected. Then you have to consider that that food may be contaminated and that should not be taken in. Vishiryante kurchakastu dantakasthagate vishe. If it is a toothbrush which is poisoned, now in those days it's a toothbrush in the sense that the stems of the plants which are used for the brush, the tip of that would be very fragile. That could be a sign of the poison contaminated one. Jihva dantashtamamsanam shvetashtapajayate. It produces swelling of the teeth as well as the gums as such, or even lips. अथाश्च दातके पुष्पपथ्या जम्बू फलास्तिभिः सक्षुद्रैः प्रच्छिदेषोपे कर्तव्यं प्रतिधारणम् अथवा अंकोठमूलानि त्वचः सप्तक्षरस्य च शिरीषमाशकावापि सक्षुद्रा प्रतिधारणम्. In such condition, प्रतिसारणं with any of these substances can be done. Then jihva nirlekhak kavalau dantakashtavadadishet. Even poisons which could be contaminated in the jihva nirlekhak, that tongue cleaner, also may produce similar symptoms as that of the dantakashta, and there again the treatment will be the same, pratisarana. Then pichilo bahulo abhyango viparno va vishanvirah स्फोटजन्म रुजास्राव त्वक्पाकः स्वेदनं ज्वरः दरणं चापि मांसानाम् अभ्यङ्गे विषसंयुते तत्र शीताम्बुसिक्तस्य कर्तव्यम् अनुलेपनं चन्दनं तगरं कुस्सं क्षीरं वेणुपत्रिका सोमवल्ली अमृता श्वेता पद्मं कालीयकं त्वचं कपित्थरसमूत्राभ्यां पानम् एतच्च युज्यते. Then during the abhyanga, that application of the oily substances, if it has a poisonous substance, it can produce a discoloration, or it can produce eruptions over the area, or there could be pain, or even discharges can occur, or pakpaka, septic foci on the body also can occur, or there could be excess of sweat or fever, or skin may become disrupted, or even the deeper tissues can be affected due to the visha. In such conditions, immediate treatment would be wash off that oil with the cold water and do the lepana with the chandana, takara, kusta, etc. Utsadane parisheke kashaya cha anulepane shayavastratam streshu jayam abhyangarakshanihi. When poison is added in the utsadana, that substance which is rubbed over the body, or parisheka kashaya or anulepana, in these also, or shayavastra, which comes with the physical contact, substances which produce the harmful effects due to the physical contact also may produce a similar symptom, and the treatment would be same as that of the abhyanga induced condition. Many of these symptoms, they look like the contact allergy, contact sensitivity, hypersensitivity due to the contact. Whenever a person is having sensitivity to a substance, and when he comes into contact with that particular substance, it produces the same symptoms. Very often it can occur during our routine panchakarma treatment also. Some of the persons who may be sensitive to some tailas or some contents of the taila may develop these symptoms as such. So that becomes relevant. Keshashatah shirodukkham khebyascha rudiragamaha granti janmakta uttamaangeshu vishadrishte avalekhane pralepo vibhoshastatra bhavitaah krishnamrittikaah ऋष्य पित्त घृत श्यामा पाली दंती तंडुलीयकेहि गोमे स्वरसो वापि हितो वा मालती रसः रसो मूषिकपर्ण्या वा धूमो वा आगार संभवः. Due to contamination of the comb may be contaminated and or may be poisoned, and when it is used, it may produce keshashata, hair loss, or pain in the head, or there could be bleeding from the skin of the scalp, or there could be eruptions over the scalp as such due to that poisoned comb as such. And in such conditions, the local application of krishnamrittika or animal's pitta, that bear's pitta, that bile of bear animal, ghrita, shama, etc., or gomeswarasa also can be applied over the area, or mushka paranirasa, agara dhuma also can be applied. Shiro abhyangah shirastranam stanam mushnishamemaja sajasya vishasamsisa sadhe avalekhanat. If any other material like abhyanga of the head, or the protection, either helmets which are contaminated, or maybe the other head garments which are used, head covering which are used, may be contaminated, or other decorative items like saja is mala, that garland, also if it is contaminated, they would have the similar symptoms as the same avalekhana, and the treatment also is same. That's all due to contact allergy, hypersensitivity due to contact reactions. Then mukhalepe मुखम श्यावं युक्तम अभ्यंगलक्षणैः पद्मिनी कंटकप्रत्यये कंटकैश्च उपजीयते तत्र क्षौद्रघृतं पानं प्रलयपश्चन्दनं घृतं पयस्य मधुकं फञ्जी बन्धुजीवः पुनर्नमः. Due to application of the cream over the face creams, if they are contaminated, if they are producing the irritation, they may produce similar features as that of the abhyanga, like spota, irritation, etc. Or they may produce the akin, padmini kantaka, akin-like lesions, chronic akin-like lesions. In such conditions, the treatment is kshaudrakritam panam, pralepa, chandanam, ghritam, application of chandana or ghrita, and consumption of kshaudra and ghrita, as well as madhuka, pandujiva, etc. can be given. Aswasthyam kunjaradinam lalasravo akshiraktata स्पिक् पाय् मेढ्रमुष्केषु यातुश्च स्फोटसम्भवः तत्र अभ्यङ्गवदेवैष्टाः यातृवाहनयोः क्रिया. Now, in those days, the traveling means of traveling were mainly the animals like elephants or horses. Now, it could be the seats of your two-wheelers or four-wheelers, which may have these contamination. The evidences will be in case of animals, the animal's behavior may be seen, the animal's eyes may be red, they may have more salivation. And after you have sat on the animal, that seat, you may have pain in the perineal area or scrotum or maybe in the penis, or even there could be spota eruptions. Treatment will be as in case of the abhyanga induced poison, similar protocol of treatment can be done. Then Shonita Agamanam Khebhya Shiroru Kapasambhava Nasya Dhumagate Lingam Indriyanam Chabaikritam Tatra Dugdhi Gavadinam Sarpi Sati Vishe Shridam Pane Nasya Sashvetam Hidam Samadayantikam. Due to the poison which is consumed in the form of either nasya or the dhuma, in the form of the smoke, it can produce either hemostaxis, epistaxis, bleeding from the nasal cavity, or there could be headache or discharges from the nose, and the treatment will be you have to give cow's milk and or ghृता with ativisha or madayantika also can be added or given. Gandhahani vivarnatvam pushpanam lanatam bhavet jikratasya shirodukam varipurne च लोचने तत्र बाष्पेरितं कर्म मुखालेपे च यत् स्मृतम्. Now the flowers which are used for garland and decoration of the body, they may just become like maybe looking to be dried or maybe dull looking if they are contaminated, and if you smell them you may have headache or there could be discharges from the eyes. In such conditions, the treatment would be as in case of the Bashpa-induced poison or Mukhalepa-induced poisons. Karnatailagate Shrotra Vaipunyam Shopavedane Karnasravashcha Tatrashu Kartavyam Pratipurnam Saraso Bahuputrayaha Sagrataha Kshaudasanyutaha Somavalkarasaschapi Sushito Hita Ishyate. If the poison is through the eardrops, Karnataila, then it may produce abnormality of the hearing or swelling or pain there, or even discharges from the ear could occur. In such conditions, you have to again do the Karna Purana with the different drugs like Bahuputris, Ghृता, Kshaudra, etc. Then Ashrupadeho Dahasya Vedana Drishtivibhramaha Anjane Vishasamsiste Bhavet Andhyam Atapiva Tatra Sadhyo Ghृtam Peyam Tarpanam Cha Samagadam Anjanam Meshasundasya Niryaso Varnasya Cha Mushkakasya Ajakarnasya Feno Gopikta Sanyutaha Kapikta Meshasundyoshcha Pushpam Bhallatakasya Va Ekekam Karyat Pushpam Banduka Ankotayorapi. Now, if the poison is administered in the form of anjana, that coryllium which is added to the eyes as such, it can produce excess of tear discharges, burning sensation, or even visual abnormalities, or even complete loss of the vision can occur. In such conditions, Tarpana yogas with different drugs or the anjana, specified anjana with Meshtunga, Niryasa, etc., they can be used as such. Shopaha, Sravaha, Tatha Swapaha, Padayoh, Spotajanmaja, Bhavanti Vishajustayam, Padukabhyam, Asamshayam, Upanat, Padapithani, Padukavat Prasadayat. The footwear which can be contaminated, which can produce irritation, could be producing swelling and eruptions in the foot, or there could be discharges also, and the treatment would be as in case of any other physical contamination, mala, etc. Bhushanani hatarchimshi na vibhanti yathapura swani sthanani hanyuscha dahapakavadaranihi paduka bhushaneshu uktam abhyanga vidimachareta. In the paduka and bhushana, that other ornaments, when they are used, they may produce, the ornaments may look like they have lost the luster, and when they are put on the body, at that point where they come into contact with, they may produce burning sensation or even suppuration as such, and the treatment will be as in case of the Abhyanga induced pathology. Now, all these are signs of the contact induced irritation. Vishopasargaha Bashpadihi Bhushananto Yairitaha Samiksh Upadravamstasya Vidhita Chikitsidam Mahasugandhim Agadam Yam Pravakshamitam Bishaka Panalepanaseshu Vidhita Anjaneshcha Virechanani Tikshnani Kuryat Prachadanani Cha Sirascha Vedhayet Kshipram Praptam Misravanam Yadi Mushika Ajaruha Vapi Haste Baddhava Tubupate Karoti Nirvisham Sarvam Annam Vishamayutam. Now, the treatment in general for all these would be You have to examine each of these and then treatment has to be done. A general agada is mentioned in the coming chapters. Mahasugandhi agada is mentioned as such later, and it could be used for consumption as a general protocol for all poisoning conditions. Or the other protocols could be virechana, chardana, sirabhyata, and or maybe tying some specific substance like ajaruha, mushika. These the dravyas over the body can help in keeping the poison effect away. हृदयावरणं नित्यं कुर्याच्च मित्रमधिकः पिबेत् घृतम् अजेयाख्यम् अमृताख्यं च बुद्धिमान् सर्पिः दधिपयक्षौत्रं पिबेत् वा शीतलं जलं मयूरान्नक्रूरान् गोधाः पृषतान् हरिणानपि सततं भक्षेत्यापि रसां तेषां पिबेदपि. In general, you have to protect the heart. Hridayavaranam nityam. Cardio protective regime has to be done, and the cardio protective regime is consumption of ghrita, particularly Ajaya ghrita and Amrita ghrita yogas, which are mentioned later on, and consumption of sarpi, dadhi, payah, that products of milk or kshaudra, honey, or cold water, or the consumption of the flesh of peacock, nakula, that's the lizards as such, or godha, or even deers. These animals' fleshes are considered to be having a protective effect over the possible poisoning. Godha, nakula mamseshu, harinasya cha buddhiman, dadyat supistam, palindim, madhukam, sharkaram tata, sharkara, adimshede, mayure, samahaushade, parshate, chapideyasyu, pittalya, samahaushadaha, sakshaudra, sagratascheva, shimbi, yusho, hitastra, vishagnani cha seveta, bhakshabodhyani buddhimana. The other regimes, again, same continuation, the flesh of godha, nakula, etc. And for that, you may add palindi, madhuka, that preparation as such. In mayura mamsa, peacock's flesh, you may have sharkara and ativisha and so on. The preparation, which may become irrelevant now because these are wild animals and consumption of these would be punishable. Pippali, madhuka, kshaudra, sharkara, ikshura samagri, charde, gupta hridayo, bhakshiram, yadivai, visham. A general protocol, if at all you have consumed any poisonous substance, would be vamana with protecting your heart, and vamana with the pippali, madhuka, kshaudra, sharkara, etc. With this, we conclude this chapter, annarakshakalpa. As such, if there are any questions, otherwise we will continue in the next passage. Right, there are questions, so we will wind up today. We will continue in the next session.